As Chief Nursing Officer of the Bristol, North Somerset and South Gloucestershire Integrated Care Board and Integrated Care System, I would like to say a massive thank you to all the hard-working nurses across our local communities. There is such a variety of nursing professionals in our area across all sorts of settings, including the NHS, social care, in hospitals and in communities, in clinics and in people's homes across our area, covering specialties from adults and children to learning disability, mental health and primary care community. So, International Nurses Day is all about you and celebrating what you do on behalf of our community and celebrating all that our profession is about. So I'm really pleased that we're going to hear from some colleagues in the ICB about their nursing careers, what they do in our communities and how they'll be celebrating this special day.
At a time when resource management and sustainability of services are at the forefront of our minds in the ICB, it's more important than ever to focus on both nursing staff and the patient. As nurses, we don't just hold the power to save lives, we touch lives, we shape lives. And as nurses in the ICB, our role in this shift is vital. We see this best in the fantastic work across the CNO office, nurses ably supported by administrative and business partners who work together to provide funded care services across our footprint. We see this in the development of personal health budgets, personal-centred care assessments, and practicing least restrictive options in care to promote independence and shaping services through collaborative working with experts by experience. We listen rather than holding the control over patients. While seeking investment in services is a positive step forward, we must never underestimate the power we hold as nurses and staff within the NHS. Keep these ideals in your mind as you work towards an excellence in care delivery. Keep focusing on the individual and moving from what's the matter with them to what matters to them. Enjoy International Nurses Day and thank you for all you do.
Please today and every day take an opportunity to pause and reflect and celebrate on the expertise of our diverse workforce that makes such a difference to children and families daily within the UK and the rest of the world. Today, let's celebrate our NHS, our health and social care colleagues and our community staff. Thank you all so much.
Massively proud to be a nurse. And I think to have a job in which you get the opportunity to help other people every day, I feel really fortunate to be able to be in that position. International Nurses Day is always an opportunity to get in touch with old nursing colleagues and new nursing colleagues, touch base with them, find out how they are, where they're working, what they're doing, and really just be reminded of the network that we're in as nurses, really. So that's what I'll be doing, and taking some time out just to think about what a fantastic career nursing is, and how lucky I am to be one.
Nurse to me is privilege, it's about compassion and empathy, and it's about that drive and dedication to make a difference to somebody's life. We don't always get the best outcomes, but part of a nurse is being resilient and be able to work with colleagues, other agencies and patients to try and support them through those changes. So International Nurses Day. So we are a family of nurses. My daughter's a nurse, my husband works in mental health, and there's me. So actually this weekend we've got a family birthday, so we will be celebrating with a dinner.
I feel incredibly proud to be a nurse. I'm a paediatric nurse by background and also a health visitor, and I now work within the safeguarding team. I feel like I'm able to offer my years of skills and experience within paediatrics and health visiting to help support other nurses from the position that I'm in now and help basically implement change. I feel inspired by all the other nurses and the variety of nurses that we also have. I think the career can be so wide and have such amazing experiences for you if you choose that career path. Particularly my role might not be what you envisage when you think of a nurse. I don't wear a uniform, I don't go to a hospital or a GP surgery to work. I'm mostly office based, but feel that I can make a big difference to children and adults that live within our postcode areas. I think it's so important to highlight all of the amazing diverse work that all nurses do every single day, 24 hours a day as well, 7 days a week. And there's never a complete rest period for a nurse. I really believe it's part of your identity, and we all have such a sense of belonging to the nursing community. I will be celebrating with my friends and family on International Nurses Day, and I hope that all nurses from all walks of life can have a really enjoyable day.